Believe me, this has been quite a learning experience, and if there is something that I can say is there's no easy answer. We are all want to produce savings when it comes to the healthcare system, but and to produce an integrated system and the benefits of health IT. Everybody talks about it. But how do we get there? That's the real challenge. And we hear about the cost of adopting EHR system and the lack of benefit, of direct benefits, especially true for small practitioners. Dr. Plotnick, I would like to ask you, in your estimation, what barriers to EHR implementation do psychiatrists faced, and what are the unique challenges to the mental health profession?
A few barriers that come to mind offhand. There are not a wide breadth of software options to choose from that are specific to mental health care and psychiatric treatment settings. So selecting a system that will work for the solo practice psychiatrist is a challenge. As I mentioned, psychiatrists often have very small offices and little administrative support, so all of the work involved in selecting a system, putting it together, and then maintaining it falls disproportionately on the physician themselves, which takes away from the time for clinical care. The cost, as has been discussed by most people at the table today, is particularly has a particular impact on psychiatry, the solo practice, in terms of the overall revenue, and the number of patients that psychiatrists see tend to be fewer than some other clinicians, which provides less opportunity to make up the cost savings for the expense of the system.
Do you have any specific recommendation in terms of your profession as to what we can do here in Congress that will alleviate?
That's a hefty question. I think that the issue of standards that's been raised is true with psychiatry as with any other profession. Right now, every system works on its own, and there's a little opportunity for connecting between clinicians or within the inpatient setting. So assistance in providing interconnecting systems would be quite advantageous.
Thank you. Dr. Talley, I heard you loud and clear. The cost, the preliminary cost, $15,000, the $5,000 monthly maintenance fee, the 30% turnover, how we compromise continuity of care, the loss of productivity, not having system interact with, communicate with each other. So the question of obsolescence is of particular concern to small practice specialists who rely on fairly sophisticated system. Have vendors responded to this concern, and what steps in the health IT industry would help to alleviate this problem of investing in a system that may not be usable in 5 years?
Madam Chair, the fact that it is obsolescent, we're no different than any other industry because there are continual upgrades. We have to keep up with the technology. We're not using a CT scanner that was developed in 1988. Now what used to take 30 minutes can take 12 seconds. EMR must, and all electronics, must continue to evolve, which dictates that parts of it will become obsolescent, just as the new internet. And that's the reason we've actually made the chose to go on an entirely new platform. It's a matter of how to adapt to this at an affordable cost. Neurosurgery in particular is hampered by the fact that there is no company that would be willing to invest the amount of time to develop a specific neurosurgical program. There's not enough of us to make it financially viable. And we have the most complex template that one would have to construct. the Congress can act pretty much as a convener to try to orchestrate those involved to adapt certain standards. We are doing this currently with MRIs, so that all MRI information has basic platforms that all of us can read. Currently, that's not the case. But if we had a basic platform that we could all read, such as what we would now call interoperable, then as progress develops and technology improves, then someone could simply tack on an additional feature, but the basic system would still be there.
Okay.
And that is where I think that your role would be very helpful.
Okay. Thank you. Dr. Gottlieb, you point out that the average pediatrician's Medicaid payment is about 2/3 of what is received by adult care doctors for the same service. And this will seem to place pediatricians at a distinct disadvantage when it comes to health IT adoption. What is needed from us, Congress, to encourage greater adoption of health IT by pediatricians?
Well, I think, first of all, if there were incentives, they need to pass through something other than Medicare, because we have no access to those funds. The only funds that I've seen come through Congress recently is with the S-CHIP program, which could get us as much as $200 million over 10 years. And you guys have passed that, but it's been vetoed twice, and it's sitting somewhere. So finding some way to get funds for us to do it would be a real help. Another thing that is not an academy position, but an idea that I'd like to suggest is you've done it with drugs, where you've given benefits to drug companies to include pediatric research for medications. Maybe you could do the same thing with health information technology people and say, if you have the functionality that pediatricians require, there's some benefit to you.
Okay. Dr. Hale, Dr. Bort, let me go with you first. Health IT security poses a significant challenge to physicians trying to access their patients' information outside of their office. You suggest standardizing electronic health record system as a possible solution. What steps at the federal or state level could create this standardization and ensure the security of records?
I guess the way I would approach this is that looking at the cell phone industry as an analogy, what is so frustrating to us, Madam Chairman, is that we have, if all of us in the room have a cell phone, and we all have, there's a multiple number of carriers, but if they did not communicate, it would be so frustrating because we couldn't talk to one another, even though we had the cell phones, et cetera. And that's what we're living with, I believe, in HIT at this point, because the security is not, I believe they're all encrypted in ways that I don't entirely understand. So it's not a safety as much as a communication problem that we're encountering that leads us back to resorting to endless faxes and defaulting to paper, which is the lowest common denominator. Mm-hmm. I believe, as was mentioned earlier, that HIT has lagged far behind the rest of the, for example, the business sector, where everybody lives on a BlackBerry, and we're not using that technology at this time. In healthcare, I have a couple thoughts that, first of all, it's a paradigm shift because we've all been on paper and we have our workflow issues. So it's easy to do different paper patterns in that regard, but now we're bringing a paradigm shift with the computers, and that's a big step. Now, if we would give computers, electronic prescribing, for example, to medical students, they would never have a paper pad or understand that. Since they've all been weaned on Game Boys, etc., that's no big step for them. Mm-hmm.